Okay, let's get started then.
Okay.
Don't know why it's so. Okay, so zoomed in. Alright.
Why do you want to be a doctor?
Okay, so just give me a minute to think. uh, okay, why do I want to be a doctor? So, throughout my life, I've gone through experiences which align towards the personalities that a doctor could attain. Experiences such as medical health problems amongst my peers and my family and friends, where they had to deal with problems such as celiac disease or diabetes, and those experiences taught me how to get involved within the community, understand complex medical health problems, understand the changes that health problems could cause to somebody's lifestyle. And I think from these experiences and my work experience at Salford Royal Hospital, it really shaped my perspective of medicine. And I think being a doctor aligns once again with how I experience the world, and I think it aligns well with my personality.
Okay. What do you think makes a good doctor?
Okay, just give me a minute to think about it. Okay, so to become a good doctor, and what I think makes a good doctor is understanding the healthcare system from the perspective of the patient. And I think understanding how the patient feels at moments of vulnerabilities and insecurities, I think it's very essential to becoming a doctor, where displaying trust and clear and concise wording, because I understand that medicine has many complex factors which are pretty hard to portray. So I think it's very essential for a doctor to portray information in a way that is understandable into, how I would say, bite-sized pieces for the patients to understand, and not just the patient, but it just shows that you understand what is actually going on with the patient, giving plans and coordinating future plans for lifestyle and how they will go on with the future. I think is really essential. That's my first point. My second point is displaying trust and empathy, right? I know from my experience at Salford Royal Hospital, the consultant would almost try to be on the same level, you know, try to almost talk in a very compassionate tone, try to speak slowly so it's digestible, and try to portray information in an easy kind of manner for the patient to understand. So I think that's the most important part, is the patient-doctor relationship. That's really valuable.
How would you balance your outside interests with studying a degree?
Okay, just give me a minute to think about that. So how would I balance my outside interests with the medical degree?
Yeah.
Okay. I think interests outside a medical degree, such as exercise and sport, and maintaining a healthy diet. I think that's really essential to becoming a doctor, because you also understand how a patient, what the patient has to deal with in a day-to-day basis, right? And I believe taking your own advice as a doctor when it comes to exercise and a healthy diet would make it better to portray information in a way that's more understanding because you've actually been through such, I would say, challenges.
Okay. What responsibility do you have?
Yeah.
Baba bytta sir.
Yeah.
Baba telefon.
To answer that.
Sorry?
Is that call for you to answer?
Yeah, 1 second. It's not a big deal.
You might have already asked you this one. Why don't you want to be a nurse?
Oh.
Yeah, they always ask that one. Do you know the structure to it? I'll give you the structure and
Go
you
on.
do it. You have to first show that you know what the roles of a nurse are,
Yeah.
compare them to the roles of a doctor, and why you find yourself to be, you want to be the doctor role.
That's actually a hard question.
Without disrespecting.
Yeah.
Yeah.
Usually nurses are put as like lower level,
Yeah.
but you have to show them that no, you actually know that nurses hold a crazy amount of responsibility and they do a lot of work,
Yeah.
but you just personally find yourself to want to do doctor role.
Yeah. Yeah.
That's the structure
Okay.
for it.
So I'm gonna take a minute to think about this one.
Baba bytta sir.
Well, it's not a big deal. He knows it's important.
It's good that that's not the first in the interview. He's just been asked that.
Yeah. Alright, yeah.
I have something to
Think
TikTok
about a
about.
range of other healthcare professionals as well that they might ask you about.
Yeah, pharmacists.
Yeah,
There's
pharmacists.
like lab people. They can ask you about any profession. You need to know. You need to show that you've actually
Yeah,
done
the
the
insides
research.
of like, yeah.
Because you could have just applied to medicine just to apply to it.
Yeah.
You have to show that no, you've actually considered every other role in the healthcare,
Yeah.
and you know what each of these roles are. But no, for me, the medicine's the best.
Exactly, yeah. So I'll just take a minute to think about this one.
Are you sure you don't want to respond to your dad?
He knows it's important. He'll call later, innit? So, why don't you want to be a nurse? Okay, I think I've got an answer now. So why don't I want to be a nurse? So the reason I picked medicine instead of saying, for example, a nurse, I think understanding the role of the nurse, which is taking responsibility, helping the patient, being empathetic, I think that aligns with being a doctor, but not so much to the extent where it kind of aligns with everything I want to do. I feel like medicine aligns with more of what I want to do. And I know that sounds kind of generic, but I'll explain what that means. So as a doctor, I understand that taking responsibility is one of the main things in medicine. It's the Hippocratic Oath, do not harm. I think that's the same for nursing, but I think medicine, I particularly enjoy medicine because it's a career where it's important to keep up with the patient, take responsibility of the patient. It's high risk as well. I understand that. There's a high rate of burnout, but I understand that with medicine, I think the most satisfying thing about medicine is being able to not just take responsibility of the patient's health, which I understand is essential, but also seeing that patient get better with your knowledge into the medical field. As a nurse, I understand that there are limits within the nursing aspect where you don't have as much, no offense to nurses of course, but you don't have as much medical knowledge on the insides.
I don't think you can say that.
Alright, go on, explain it to me then.
I have a TikTok that I've sent to you about it.
Do you remember it?
I've got it saved. I have a whole playlist. That's why I asked you if you had TikTok. I was going to just send you my whole
Yeah, no, I
playlist.
deleted it. No doom scrolling for me.
You don't have to doom scroll.
No, it's the thing is, like, I just doom scroll no matter what, so I can't control myself. It's just one of my.
That's something you should work on then. Not
Yeah.
rather than staying away from it entirely. You should work on being able to control yourself.
I don't know. It's just I can't control myself. Might as well just delete it. Anyways, so do you remember the TikTok? Oh. Should we work on another question meanwhile?
I don't know where your phone is.
Oh shit. Okay, here you go. It's good that you asked that one. It's a very challenging
Yeah.
one, to be honest. Gets you thinking a little bit. But dude, if I was in that interview, They asked me that question. I'd be cooked.
There's so much to it, you know. Hello.
Yo, by the way, I'm recording.
You're recording?
Yeah.
Ah, is it for your YouTube channel?
Yeah. It's practicing medical interviews.
Yo, you have a shirt.
Hold on.
Well, it's not the cleanest, but...
Okay.
That's a really difficult question because, of course, nurses are integral to the NHS, and
Ooh.
if I wasn't going to be a doctor, I would certainly have nursing high up there on the jobs that I would do. I think what's important to know in this question is to know what a nurse actually can do and the differences between a nurse and doctor. So when you the NHS, everyone is equal, no matter what stage in training they are. Obviously, there's something that nurses can do and some things that nurses can't do. For example, nurses are very top level, can prescribe, they can help diagnose patients, they can provide a lot of care. That's something that maybe doctors don't get as much time with the patients as nurses do say. But there are also the other point, which is that doctors ultimately are like the spearhead of the patient's treatment, and they ultimately make the final decisions to do patient treatments. And as well as that, obviously, doctors are the only ones that can do surgery, and this is something that I'm really interested in, and it's something that I did my research topic on back in school. So I think, combined with the fact that there is a lot more depth of science as well in medicine, and it's probably one of the reasons why I probably chose medicine over nursing. However, I do fully respect everything that nurses do, and on my work experience, I was on a lot of time on wards with nurses leading the rounds, and nurses providing a lot of input into the MDT. And so while I do value nursing and the contribution that it does to nursing, I ultimately think that medicine would be a better way for me, just because of the broad academia, spearheading the treatment plan, and ultimately coming up with the final decisions, which is something that I would really love to take responsibility for. And I think I would just be able to have a better impact in my capacity as a doctor.
Okay. Yeah. I actually think that's a good one. So,
Do you want me to send this to you again?
I'll actually read you the question. So, why no nurse?
No.
So, already, like, I understand, like, they can't prescribe. Can they prescribe or they cannot prescribe? No, they can't prescribe medicine. Yeah. Can't prescribe medicine. I don't know if that's true or not, so I'll watch this video, see if if that's true. So they can't prescribe, they can't do surgery, they can't consult either, can they?
No.
Because they don't have full information of the patient, do they?
They do have information on the patient.
They do
Not
have-
records, but it's
yeah.
just,
But no, yeah, they can't give plans to the patient. They can't give like, okay, what's the future plan? Only a
Alright.
doctor can really decide. Oh no, it's fine. What is he doing? Anyways, they can't give like a full-on dedicated plan. And overall, they're not as specialized as a doctor is, are they?
You wouldn't say that though. Because what does that mean? No, they're completely specialized as a nurse.
Yeah.
You're completely specialized as a doctor. It's like saying an
No, but
engineer
like-
is not completely specialized as a
Be-
teacher.
But like, if you think of like medicine, there's like the gastroenterologist or the cardiologist or the other specific parts. You've got pathology.
Yes, but they're different degrees. They're not. You can't say one is more qualified than the. You
No,
can't-
but that's like why I want to do medicine instead of nursing.
I think you can specialize in specific things, and because I know somebody who's going to become a mental health nurse.
Yeah.
You can become probably a cardiologist or something.
Yeah. Okay. Well, what about the surgery aspect of it? I do enjoy surgery, so
You can become
a
a
nurse.
scrub nurse.
Huh?
You can become a scrub nurse.
Well, I want to be the main guy.
Okay, there you go.
So
So
there
that
we
you'd
go,
say
yeah.
that, yeah.
Yeah. So, being the main guy. I want to say being the main guy, But
Shouldn't say that, no.
no, but like again, like taking responsibility for the patient. Now we're getting more informal, just to get like it into our heads. So, like, tell me about your mother. Alright, interesting. So, taking responsibility for the patient, like full responsibility, deciding patients. How would I say it? Because you decide what the patient's going to do in the future. Diagnosing patients as well. That could be one. Yeah. Okay. Should we go to another question then? Probably work on that.
What responsibility do you have?
What responsibility do you have? Is it like specific? Is there more to it, or
No, it just says what responsibility do you have.
as a doctor?
No, it just says what responsibility do you have. What are you responsible for? You can talk about like your Saturday job.
What responsibility do I have in general? Yeah. So let me think about that one. Responsibilities. Okay, I think I got one. So, in general, my responsibilities are as a friend, as a family member, as someone who looks out for their community. I feel like my responsibilities are to, if they are in a medical, something medically changed for them, which caused a shift in their lifestyle, I feel like it's my responsibility to understand what that shift is and how to help them overcome the challenges of like possible medical problems. Um, Also, outside of medicine, I feel like my responsibilities are to always be compassionate um, under any sort of challenge, whether medical or non-medical. When it comes to regards such as mental health, for example, exams, family strain, and also outside of mental health, possible financial problems. I'll try to be there and understand the situation and how I can help and find any possible um, and try to advise on anything that I understand pretty well, as clear and concisely as possible. So that's my general responsibilities, I feel like, as a human being. Yeah.
It says, what will you do if you are not accepted into medical school?
If I did not get accepted into medical school, that's actually a pretty darn good question, I can't lie. Alright, let me think about it for a second.
6 or 7 minutes.
Hold on, let me just close the door. Okay, what would I do if I didn't get accepted into medicine? So, if I didn't get accepted into medicine for the first year, I would try to undergo. Hold on, let me think about it for another minute. Okay, if I didn't get accepted into medicine, the first thing I would do is definitely pursue more good habits, and possibly reapply. But during that process, I would look more into research, you know, pursue a hobby of just researching possible like myths, possible misunderstandings in the medical field. I would probably do more work experience as well, at more hospitals. Try to understand the doctor-patient interactions and make that my advantage for me to reapply back into the medical field. If it were my grades, I would redo some of my exams to further increase my grades and increase my potential into getting into medical school. So I think in regards to that, just more work experience, more exams if that was the case, and probably practice more interviews.
Okay, definitely. What do you think makes a good team?
Okay. So, what do I think makes a good team? So, from my understanding of what a team is, it's a group of people working together for one single purpose or multiple purposes. That could be sometimes the case, but it's working towards a purpose. And I think what makes a good team is actually having some sort of roles within the team where people have roles to not cause any misunderstandings, not cause any problems in the long run. So roles are very essential when it comes to a team. I think also what is also essential is communication. Communication, as they would like to say, communication is key. And within a team, having good communication is essential because you can really be able to express any sort of problems really well, understandings, and it can drive that almost purpose better rather than everyone working sort of in an individual basis. Even though sometimes there is a team, I understand that sometimes it can be quite individualized, if that makes sense, for lack of a better word. So having communication, I think, is very key. I think also being concise and clear, not really acting irrationally, being rational and communicating well. I think it's the most essential part of teamwork because that's how teams are formed, and that's how a good teamwork basis is possible. Yeah.
What do you think about abortion?
So I understand that abortion is a very controversial topic, which there's like many religious views into it, very much opinions in regards to abortions. So I think in regards to abortions, I think I would try to align with the patient's point of view rather than go with my own point of view, because I understand that many people have different sorts of opinions in regards to abortions. So I'll try to be more flexible within the person's opinion rather than be straight and say, no, abortion is wrong, abortion should be forbidden, or abortion should happen or shouldn't happen. So I think just aligning with the patient's opinion who is dealing with abortion, I think it's the most responsible thing to do. There we go, we finished. We're going to do more questions next time, right? Okay.